All right, and before I start this broadcast, Steve, can you just confirm with me that what you're seeing is our slide deck, correct?
I'm seeing the title slide.
Perfect. All right, so it looks good?
Yep.
All right, so here we go. I'm going to start this broadcast. Excellent. We're going to give folks about a minute to join the webinar, and then we'll get started.
Break a leg.
Good afternoon and welcome everyone. I'm Steve Schwab, CEO of the Elizabeth Dole Foundation. We are excited that so many of you are able to join us for today's Spotlight Series webinar on accessing VA self-care and whole health resources during the COVID-19 crisis. Just a few words about the Elizabeth Dole Foundation. We were founded by Senator Elizabeth Dole in 2012 and are fully dedicated to supporting and empowering our nation's 5.5 million military and veteran caregivers, and of course, their families. In this uncertain time, the Foundation has teamed up with our partners at the VA and Philips to provide veterans and their families with information about high priority topics. Our first session focused on telehealth services and had an incredible 21,000 views over the last month. This month, we're bringing you content related to how you can access self-care and whole health resources. A couple of housekeeping notes. During this session, we will be polling you to gain feedback on your use of whole health resources and areas where you'd like to learn more. We invite you to participate. We have a lot of information to cover today, but we will take questions at the end of the webinar. Feel free to submit any questions using the Q&A box located in the Zoom control panel. During this session, 3 people who submit questions will be randomly selected to receive a $25 Amazon gift card as part of today's broadcast. So submit your questions and be sure to listen for your name as we draw those towards the end of the session. I also want to mention to all attendees that this is a recorded broadcast. Today's webinar will be available and shared following this session. I'm now going to turn it over to Dr. Stephen Lieberman, who serves as the Principal Deputy Undersecretary for Health at the VA. In this role, he leads clinical policies and programs for the Veterans Health Administration. Dr. Lieberman has more than 25 years experience with VHA, working at both central office and at VA hospitals in Massachusetts and in New Jersey. Dr. Lieberman, I'll now turn it over to you for a brief welcome.
Thank you so much. I'm honored to be here with all of you today. I want to acknowledge my appreciation also for our wonderful partnership with the Elizabeth Dole Foundation. VA could not fulfill its mission of caring for veterans without the support of organizations like this one. COVID-19 has been the most formidable medical challenge that the world has faced in about 100 years. These certainly have been trying times for us, and we all can probably do a better job with taking care of ourselves. I am included amongst those that probably can do a better job with self-care. I'm hoping that today's webinar will help us all to better understand how we can take care of ourselves and those whom we care about during these stressful times. VA continues to remain busy with its response to the pandemic that dates back to January, when the world first became aware of cases. Since then, VA continues to maintain comprehensive infection control preventive measures, including screening for COVID-19 at entrances of all our campuses, and restricting access to all of our inpatient sites and our community living centers. VA rapidly has expanded its testing capabilities nationwide. We now offer testing to all patients who are eligible for care for active coronavirus disease by nasal swab antigen testing. And this can be provided to those who are symptomatic, as well as any veteran who feels they want to know if they have an active disease and want to get such testing. If interested, I suggest you reach out to your primary care team. Additionally, VA facilities are preparing to make the antibody serology testing available soon. This is the test that can tell you if you had an infection in the past. When I last spoke on a Elizabeth Dole Foundation webinar, such testing was not reliable. And fortunately, in recent weeks, it has become much more reliable. And soon we will make this available to all of our VAs. While we continue to see patients in face-to-face appointments for more urgent matters, in order to reduce the risk of exposure to COVID-19, we increasingly are providing care using virtual technologies such as video telehealth and telephone care. This allows veterans and their caregivers to remain at home and not be at risk of exposure. As a result of our efforts, our telehealth program has grown dramatically over the past few months. Back in January, we completed 138,000 telehealth appointments. By April, we had completed 400,000 such appointments. For mental health care, virtual appointments has been shown to be as effective as in-person care. In addition to one-on-one therapy via virtual health, we also hold group therapy sessions via video. Now it's easier than ever to receive mental health appointments from the convenience of your home using your desktop computer or smartphone. If not doing so already, I encourage you to check with your clinical care teams at your own VA facility to learn how you might receive such an appointment at home. We continue to focus on ensuring that VA has adequate protective equipment, such as masks and gowns. Related to this, VA has been one of the first institutions to test state-of-the-art 3D print manufacturing technology to determine if in the future we will be able to produce some or all of our own critical protective equipment, such as face shields and masks, as well as nasal swabs for testing. VA has also hired over 12,500 new staff over the past 6 weeks. That included 2,600 registered nurses and 570 providers. This has enabled us to increase our inpatient bed capacity by almost 3,000 beds. Other COVID-19 success stories include that we have been experiencing a less than 1% infection rate in our community living centers. This is substantially lower than what is being experienced in the private sector. We have utilized our staff's expertise in long-term care to help educate private sector nursing home staff on how to optimally provide care to their residents. While the care of veterans remains our highest priority, VA has also been providing support to civilian missions in 45 states, as well as Washington, D.C., American Samoa, and Guam. As a part of this effort, we help private sector hospitals in crisis by caring for civilian patients in hotspot areas, including New York City, New Jersey, Detroit, Ann Arbor, Chicago, Spokane, and Los Angeles. Across the nation, including the hardest hit areas, our employees have risen to the occasion during this fight of our lives to care for veterans. VA's absenteeism rates are at record low amounts, and turnover rates and retirements have also dramatically fallen. I do have to say that the staff truly impresses me. They are a group of professionals dedicated to this mission. I've just never seen such dedicated staff. I'm sure many of you are wondering about when we will start to re-expand our on-site services for more routine types of care. Well, we are just beginning to gradually reopen at selected sites across the country. How quickly a given facility opens depends on how active COVID-19 is in that region. Each step of re-expanding is aimed to ensure the safety of veterans, their caregivers, and VA employees. Even once we have opened at a given facility, each VA will continue to offer expanded virtual options for those who prefer this type of ongoing care rather than the traditional face-to-face appointments. Now, I want to also acknowledge the importance of our caregivers during this pandemic and how hard you work to ensure the safety and well-being of the veterans you care for. Please remember that you are not alone. Your VA is here to help. We have the resources to keep you connected, safe, and armed with the latest information and support. Our VA Caregiver Support Program has a variety of services available to caregivers, including every VA has a caregiver support coordinator to support caregivers and link them to services. We also have a caregiver support line, which we encourage you to call if you have any questions or need assistance. This number is 1-855-260-3274. Again, that number is 855-260-3274. We also have a helpful caregiver website that provides many easy to reference resources to help caregivers. This site includes a link that is as follows. This is how you can get to it. And what I was going to say, this includes a link to helpful resources related to COVID-19. And so that website is www.caregiver.va.gov. That's www.caregiver.va.gov. Today, as always, our greatest priority in VA is our commitment to providing high-quality health care. Our staff continues to adapt to ensure we are meeting the needs of our veterans and their caregivers. Please do not hesitate to reach out to us if we can assist you in any way. Thank you.
Thanks so much for those remarks, Dr. Lieberman. I'm now really happy to be joined by our great partners at Philips for this session as well. Philips support has enabled us to launch this valuable Spotlight series with the VA, and for that, we are very grateful. Today, we're joined by Nick Padula, Vice President of Health and Human Services for Philips Healthcare. In his role, Nick helps connect government partners and providers into a completely connected, clinically integrated healthcare organization. His focus on patient-centric solution helps move boundaries and enable systems, devices, and people to share information easily and securely when and where they need it. Nick, the floor is yours.
Thank you so much, Steve, and thank you, Senator Elizabeth Dole, and the Hidden Hero caregivers and the vets that are with us today. It's great to be with you all and hoping to see you all again in person again very soon. The next slide, please. The United States has the best doctors, the best hospitals, the best academic medical centers, the best nurses, the best medicines, and we are the leaders in research. Yet the title of this very first slide is, are we practicing the best healthcare or the best sick care? I'm very proud to share that we make that cath lab and that MRI, these are the photos on the slide, incredible technology, powerful technology, and it will improve and save lives. But this is not health. Typically, when you encounter one of these systems, it's a failure of health. So this is sick care. Again, while proud of this technology and the advanced algorithms, and they do save lives, if we're going to appreciably influence true healthcare, we must go way upstream prior to what's called the full onset and expression of disease. So in the next few minutes, and through the eyes of one that's deeply embedded in the world of advanced medical technology, I'm going to provide a perspective to help you stay far away from these beautiful machines with evidence from technology like this to provide some proof points that the practice of whole health is the real deal. And this is the reason I'm most excited about spending time with you all today. Next slide, please. If you asked me 30 years ago, when I had worn a camo pattern, a different one on my uniform, that yoga could become mainstream within the US military, I would not have believed it. I would have lost the bet. Yet if I only knew the science, I may have thought differently. So in terms of the science, there is promising early evidence that yoga practice can positively impact brain health. In fact, the two sets of brain scans on the slide illustrate structural differences in yoga practitioners compared to those that don't do yoga. Simply, the science is showing that yoga practitioners are showing greater cortical thickness, greater gray matter volume, to include greater density than those that don't practice yoga. Another speaker, Dr. Ben Kligler, will go into much greater detail, yet I was compelled to show you these real physiological benefits. Personally, I'm playing a large role in leading our coronavirus response for Philips. For our partners, and I decided to walk the talk to help offset the effects of some extremely long days. Simply, I love it and looking forward to those longer term benefits that you see on the slide. Next slide, please. Philips also has a sleep business, and the link between sleep disorders like sleep apnea and insomnia and mental health comorbidities such as anxiety and depression, they're undeniable. Again, to the clinical proof points, the brain does most of its housekeeping while we sleep. And one of those housekeeping duties in particular is waste disposal. It seems to be acutely sensitive to the lack of sleep. The brain disposes of waste through what's called the glymphatic system. The brain scan to the right shows heavy deposits of these toxic proteins. They're called beta amyloids, and they're shown in red on that brain on the right side. These toxic proteins, they're linked to poor sleep, and they actually may be paving their way to Alzheimer's disease. The image shown on the left is a brain benefiting from deep sleep brainwaves and the absence of beta amyloid. And scientists are further researching the idea of this brain cleansing themselves of these waste proteins during sleep and even too little sleep, and it could contribute to other diseases such as schizophrenia, depression, ADHD, and as I had mentioned earlier, Alzheimer's. Next slide, please. For the veterans on the line, I ask you to hop into a figurative time machine and dial it back to that time when we were young, extremely fit. That photo is one of my best friends and I, and to this very day. And it was at the time of this photo, we did not know the words whole health. It was the late 80s, yet we were practicing core elements of whole health. Again, we didn't know the words, but we all did live it. The exercise, the personal and professional development, the benefits of camaraderie, and especially the considerable benefits of community that all veterans cherish to this very day. So in terms of the science, and this is for the vets and especially the caregivers, in the diagram to the right, exercise allows for muscle synthesis and the releasing of proteins as well as these metabolites right into our circulation. These molecules can cross the blood-brain barrier and they can affect the functions of neurons. It literally can modify neurotransmission in different regions of the brain. And what I love about this research, we all can get considerable health benefits with just light and moderate intensity exercise, and with immediate benefits from the very first workout. Obviously, greater benefits with sustained frequency. And simply, you do not have to train for any marathon to get considerable benefits, whole health benefits through this approach. Also, the benefits are considerable with real improvement in terms of depression, anxiety, stress, even with PTSD and trauma. And furthermore, and I just want to share this, it's equally important and considerable as it relates to chronic disease. Brain scans reveal benefits of a cardiovascular workout even for stroke survivors. Please advance to my last slide. Yoga for brain health, a prescription for sleep, food and exercise as medicine. It may be a new concept for some, yet hoping that you consider a few of these examples in your whole healthcare. I started my segment with expensive diagnostic medical machines. My experience, my personal experience, is one of technology and science. And there is a science to whole health, and at a time when many of us are still in quarantine. And what's great about this approach, it does not require the purchase of one device nor gadget. Thank you, take care of yourselves, and stay well.
Thank you. I think it's on to me now. Is that correct, Steve?
Thanks so much, Nick. I'd now like to introduce Ben. You just beat me to it, Dr. Ben Kliegler. Ben is a board-certified family physician who has worked as a clinician, an educator, a researcher, and administrative leader in the field of complementary and integrative medicine for 25 years. Dr. Kliegler is currently serving as active executive director of the VHA Office of Patient-Centered Care and Cultural Transformation. Dr. Kliegler, take it away.
Thank you. Thank you very much, Steve. Appreciate that. Let me just get set up to share my screen here, and we will be good to go. Bear with me just 1 second. Here we go. Great. So thank you very much for having me. Thank you to the Elizabeth Dole Foundation. I'm so glad to be here. And thank you to all of you out there, veterans and caregivers, for showing up and being ready to take this on as part of what you're doing during this crazy period. So that was a great review of some of the science that Nick shared with us. And what I'm going to share now is some really practical stuff that you can do and that you can take home with you or have at home with you where you already are, take on the road with you, skills and tools that can really help you manage this crazy time. And the way we're going to do it, I'm just going to talk for a couple of minutes about some of the background of this in the VA, and then we're actually going to go live on the web, and I'm going to show you some of the great resources that we've set up as part of what we're calling the #LiveWholeHealth campaign. So here we go. So for the last 7 or 8 years, VA has been moving forward with what's really a amazingly exciting, I think, and progressive approach. And hopefully some of you guys out there and some of your caregivers have experienced this at your VA or with your VA clinicians. And this is this idea of whole health. So healthcare systems generally and VA also are charged with taking care of diseases. We have problems, we have heart disease, we have COVID, we have cancer. We go to the doctor tries to take care of our health condition. And VA has done a great job with that. Really one of the most outstanding healthcare systems in the country. This is about taking it the next step. Whole health is about still being able to deliver that amazing high quality disease care, but take it the next step. So we're really talking about how to build health, how to make ourselves more healthy, more able to achieve what's important to us in our lives, better equipped to move forward with where we want to be going. And so whole health is a lot about learning new skills. And this is one of the reasons that for all the awful things about the current pandemic, there are opportunities that are being created. And one of the opportunities is for us to take charge of learning those new skills. A lot of these can be accessed really easily online. And that's what I'm going to show you some of during the rest of this talk. So just a tiny bit more about how do we do whole health in the VA. A lot of it revolves around what we call the circle of health. And the tool, that should say a tool for reflection and action. But basically, the Circle of Health covers 8 areas of what we would call self-care, or strategies for building well-being. All the things that go into potentially making us more healthy, more able to achieve what we want in our life, to do what matters to us, or that can get in our way. And you can see in front of you, those are things like working the body. So are we moving? Are we exercising? Food and drink, spirit and soul. Are we connecting with that part of ourselves? Family and friends. All the things, all these different domains that when put together really are what either make us healthy or can get in the way of where we want to be going. So basically, the way we approach this circle, and I would encourage you all to even take this on at home. I'll show you where it is online if you feel like going through some of this exercise. What matters to you most in your life now? That's kind of the most important factor. You know, where do you really want to be going? And then based on where you want to be going, you know, what do you need? What are your areas of strength when you look around the circle? What is it that you're doing well? Are you eating well? Are you exercising enough? What are the areas where you could use a little work? And can you identify one of those areas? Maybe you haven't made any connection with sort of your spiritual self in a while. Maybe that was something that was important to you, but you've lost touch with that. Maybe they're family and friends, fellow veterans, fellow caregivers who've been important to you, who you're out of touch with. Maybe that's an area where you could really strengthen yourself and really build up your own resources. So as you can see, the whole idea of this is about strengths. When we talk about diseases and we talk about managing our health conditions, we tend to talk about problems, weaknesses, things that need to be fixed. A lot of this approach is really talking about what are your strengths and how do we build on them. So that's what the rest of my time with you is going to be about, is showing you tools that we have out there right now for you that you can just pick up your phone, look on your computer, find a way to get in there, and you can start to identify which of these areas you need help in and build that strength. And really, as you'll see, I'm not going to have time to show you all of them, but as part of this Live Whole Health campaign, there really are tools for each one of these domains. So if you look at this and you think, wow, I really need to work in the area of family and friends, or really need to work in the area of food and drink, or moving the body, there are tools out there for you to take. So what am I talking about? So before I show you some of the web-based resources, let's just take a quick try. And this will seem familiar to some of you, overly simple, old hat, but just do it with me. It's only going to take 30 seconds. And it's the simplest possible thing, and it comes down to your breath. But it's not just take a few deep breaths, as we say to each, take a deep breath, calm down. It's actually about the out breath. So when we think about taking a deep breath, we think about breathing in big, but then we don't really think about the out breath. We just let it out. It's passive. But a lot of meditation techniques really are based around making the out breath longer. So try this with me for just 3 or 4 or 5 breaths. We're going to take in a large breath, but we're going to take a long out breath. So I'd really encourage you all watching this, go ahead and do this, and I'm going to do it with you. So just an in breath and an out breath. And an in breath and an out breath. And one more, an in breath and a long out breath. And I hope even just from that, you can tell when you just switch up the pattern of your breathing, when you make the out breath long, when you pay attention to it and push it out just a bit longer, you turn a switch in your physiology. You change the way your nervous system is working. And that change shifts your whole system in a direction of what we call parasympathetic function, or you might also call it the relaxation response. And all it is making the out breath a little longer. And I'll tell you, I don't generally get nervous when I give talks. I do a lot of talks, but thinking about 500 of you sitting out there or more, I was feeling a little nervous, and now, piece of cake. That 3 out breaths, that did the trick for me. So really, it's as simple as that. So now I'm going to move on, and I'm going to actually take the leap and go live on the web to show you some of the resources that we're talking about. And as I said, we won't get to go into great depth on any of them because we only got a limited amount of time, but I want you to get a feeling for what's out there. So let's get me there and see how this works. Okie doke. Hold on, just bear with me 1 second. I am looking. For all our practicing. Let's see. Okie doke. Now I'm getting close. Sorry, bear with me 1 more minute and I think we'll be there. Here we go. So hopefully you all are now seeing a web page. And one of my, Steve, can you nod your head if you're seeing that? I hope you are.
Not seeing it yet.
Not seeing a web page? Okay. Interesting.
Ben, hey,
Yeah.
Ben, if you escape out of your presentation mode for your PowerPoint,
Yeah.
you should be able to do a new share.
Okie doke. There we go. Thank you very much.
Of course.
New share. And here we go. How about now?
Yes, that worked.
All right. Thank you. So I was doing my long out breath that whole time and I'm still okay. So just goes to prove it can really work for you. Okay, so this is a starting place, and I would really encourage you guys, if you all just take one thing home from this, va.gov/whole health. That's all you got to know. va.gov/whole health. This is the homepage of our office called the Office of Patient-Centered Care. And basically, almost all the things I'm going to point you to right now are available from this homepage. So just to show you where we can get started, this is the #LiveWholeHealth campaign, and it's also labeled here as self-care blog series. So basically you'll look for this tag here on the website, go here and you can click learn more. And where this takes you is it takes you to another website, which is the homepage of the Vantage Point blog. This is an excellent resource that VA sends out regularly to several million veterans, really. And on that blog, we've been running over the past several weeks and are going to continue to run a campaign called #LiveWholeHealth. And basically 3 times a week, a new resource gets posted on that website, a little blog education, but then more importantly, a resource that you can use. So I'm just going to show you a couple of those real quick, just snippets. So here's one. I could use a vacation right now. So let's see what's here in this one. Vacation visualization. So this is in the category of guided imagery or mind-body medicine. So just take a listen for 1 minute.
Another mind-body approach is something I call a mini mental vacation. So because your body and your physiology responds to the state of your mind and where your mind is as opposed to where you really are, you have a lot of power, right? Because even if you're in the middle of something difficult or stressful, you can take 5 or 10 minutes and mentally transport yourself, mentally imagine being in a different place. And guess what? You get a mini mental vacation. So that's what we'll do next. So to start the mini mental.
So I'm going to fade that out for us. Don't want to disappoint anybody, but it's 7 minutes long and I don't want to use all my time for that. But you all can pursue that on your own. That's one of the really nice ones on there, but there's so many. And just so that you're clear, this is not all about breathing and imagery and things with the mind. There are lots of different skills on there. So let me show you one that was prepared recently by Dr. Julie Olson, who's our lead acupuncturist in the VA. You know, you may think there's no place for acupuncture during a time when we can't see our providers, but at the same time, there's acupressure, which is a way to take acupuncture and turn it into something you can do for yourself. So let's just take a listen for 1 second.
Whether or not these points are appropriate for you and your medical condition, please consider talking to your primary care provider before beginning. If you're pregnant or
just skip ahead a little bit.
And press and massage it for about 30 seconds. This point is known to be helpful keeping away colds and flu. It's also helpful for headaches. You can massage this point on both sides. The second point I'd like to share with you is also located on the hand. It's on the side of the palm here. And the point that I'm talking about is located here, right below the bony, round part of your finger, but in the palm here in the soft, fleshy area. And pressing and massaging there is helpful for neck pain. But as we move down along this area in our hand.
Okay, I know we want to keep watching all of these, but I'm going to fade out on Julie as well, and share with you guys just one more. Again, to show that we're really trying to tackle the whole perspective of the circle of health. So back to the homepage, and what I wanted to make sure you saw was that you'll see all these on here, but if you go down to the bottom, there's several pages of resources. So if you don't see something you're looking for, go to the next page. And so let's take a look, for example, chair yoga. Nick was talking about what a difference yoga has been making for him. You do not have to be a super athlete or wear yoga pants to do yoga. So let's just take a look at what we're doing with chair yoga these days in the VA.
You can use a chair with arms on it. If you have a little bit of stability issues and feel like you may fall, you'll want to use the chair. But today we're going to use one without the arms on it. So you'll want to sit nice and up tall in your seat. Try to bring your back off the back of the seat.
I'm going to just skip ahead for a minute and get a better sense of what's happening in the middle.
Your eyes were closed. Just bring that gaze slowly up. And we're going to do some side leans. Taking the right arm, reaching over to the left. Now here you can use that left hand to hold on to the chair and stretch. We'll do this 3 times to each side. Back up nice and tall and bring the left hand over, really stretching and reaching towards the wall to the right. Feet still planted on the floor. 2 more times.
So as you can see, really, so many different things, so many different opportunities here to practice different skills, to really equip yourself to move forward where you want to be. So I do just want to show you one additional resource, which is not a web page, it's an app. And this is something that was put together by the mental health folks in the VA, and it's called the COVID Coach. And basically it's an app that you can download for free to your phone, and it puts together a lot of resources, a lot of similar resources to what I've just showed you. So we'll just watch a quick video introducing that, and then I'll talk about it a bit more. So just take a look at this for 1 minute. All right, so that is the COVID Coach. I'm going to show you a tiny bit more about that if I can figure out how to get back to my PowerPoint. So bear with me 1 more second while I make my way back there. Okey-doke. Aubrey, I may need your guidance on how to get back to my PowerPoint. Oh, there we go.
I'm back.
I got it. I'm there. No, I got it. I'm here.
Just remember, new share.
We only practiced this 17 times, but here we go.
We're all learning. It's all right.
Okay, so so let's just come on.
There
back.
you go.
There I go. And let's see. I just do want to show you. Sorry, need to get to my slideshow. And I'm gonna whip ahead through a few slides that we've already covered and just show you a couple of other things. And then we'll have time for another interesting presentation from a real person, a real caretaker who's using some of these things. And then we'll have some questions. So I did want to point out that the Live Whole Health resources that I showed you, which are on the Vantage Point blog, are also on Facebook and on the VA Facebook page. They're also on the VA Instagram page. So if those are your preferred modes of connecting, we're all over the place. And then I wanted to show you just a tiny bit more specifics about the COVID Coach app. Remember, this is free get it in the regular old app store. And I love that quote there, healing takes courage. We all have courage, even if we have to dig a little to find it. And the reason I like that quote is that if you're going to dig, the best way to dig is to have the right tools. And so this is really all about this whole talk, but this app in particular is about finding the tools. So this is the front page, and then you can go to tools, and you can see a lot of stuff very similar to what I was just showing you. Body scan, deep breathing, all these kind of actual techniques you can use to help settle yourself, to help deal with some of the stress that we're all going through. And then also, I think really helpful is there's a resources tab on the COVID app where you can help if you need it. You can get yourself directly the kind of crisis support, substance use support, mental health support that you might need. So I'd really encourage everybody to pull that down and load it on your phone, and you may find it comes in handy. So then the last point I want to make is that, sorry, I'm a little bit stuck on this slide here. Okay, so all these great tools, these well-being resources, really important, really want to urge everybody to fully engage with these, pull them down, use them every day, make it a regular habit. Having said that, we're aware that sometimes things are a little bigger than that. You need somebody else, you need help, and this might apply if you're a caregiver or a veteran. The Veterans Crisis Line is still there. Here's the number. You can get there 24/7. It's waiting for you if you need it. And VA is also still providing same-day mental health care all around the country. Emergency departments are still open with mental health care available if you need it. So I think it's really important to say, yes, I can handle this with these new tools. And then it's really important to identify when there's a moment when you might need some additional help as well. So thank you so much for giving me this time and bearing with my technical challenges. And I think I'm going to hand it over now to our next presenter, and then we'll come back for some questions.
Thank you so much, Dr. Kliegler. That was awesome. I think we're all now half asleep and relaxed, so it was an effective presentation. Folks, we're going to ask you to stick around for our questions and answers. We're going to be giving away Amazon gift cards, and we're also going to be putting some polls up so that you can tell us the items that you'd like to see on future webinars that we do with the VA. I want to tell you a little bit about what the Elizabeth Dole Foundation has learned during the pandemic. Caregiver mental health has emerged as a significant area of need during COVID-19. In the early days of the crisis, our surveys revealed that service members and veterans were facing increased stress and mental health challenges, just as the telehealth services were getting off the ground. Our recent surveys have shown that while wounded warrior mental health remains a top need, there's also been a dramatic spike in the need for caregiver mental health support as well. Anxieties around the pandemic are heightening PTSD and other invisible wounds in veterans, and these increased responsibilities combined with the daily stress of tending to an at-risk loved one are adversely affecting caregiver mental health. In our second survey, approximately twice the number of caregivers reported needing mental health support. Families are managing a lot right now. For many of you, kids are at home, food and personal protective equipment are in scarce supply. Getting out of the house is virtually impossible, especially if you're caring for a wounded loved one at home. We want you to know, we all want you to know, that there is help for you out there. You're not in this alone. If you're a caregiver in need of support, please join us at our online community at hiddenheroes.org. In addition to accessing resources and finding a community of support, we've also created a special section where caregivers, veterans, service members can ask questions on any subject related to their needs, and our staff provides an answer within 24 hours. That's hiddenheroes.org. I'm now honored to introduce one of our Dole Caregiver Fellows and director of the fabulous American Red Cross Military and Veteran Caregiver Network, Melissa Como, to share her perspective on self-care resources. Melissa?
Thank you so much, Steve, and the team at Whole Health and Philips for welcoming me to this webinar. And right away, I just have to thank the Cohen Veterans Network for providing me with some mental health support, as all of those challenges that Steve just mentioned hit really hard about 1 month into this pandemic. What can I say about self-care that hasn't already been said? And I think one thing I want to mention is that self-care should not feel like another thing on a caregiver's very, very long to-do list. You don't want to have to feel any shame or disappointment or failure that you didn't get to your self-care. I think sometimes the highest form of self-care can be self-compassion and reaching out for tools and resources and peers that can support you in this caregiver journey. I've been so lucky to know Steve for years, and we've discussed my own personal self-care journey, maybe the difference between a glass of wine and a stress-relieving tea, and the fact that I've been able to lose 50 pounds and lower my blood pressure with the support I've received from other fellows and other caregivers on my journey. I still continue my self-care. Right now I'm considering a lot of volunteering and a lot of peer support as my self-care option. And I'm a huge, I cannot stress this enough, huge fan of the transformative nature of the VA Whole Health program. Not just for my veteran, but also for myself as a caregiver. Getting to the why you want your health. This is both important for veterans and caregivers. And for me, that why has been how to be a good caregiver. I want to be a good caregiver. And also, I want to be a fun mom for a very active 11-year-old that I'm homeschooling. So I went on to become a VA Whole Health facilitator, which helps me build in the time and space to practice all of those amazing tools that we were just shown. And really encourage engagement and accountability with other caregivers, which is why at the Military and Veteran Caregiver Network, we have a Wellbeing You series that features many of those activities where you can engage with other caregivers while practicing self-care in a fun, light, bite-sized opportunity, maybe only 10 minutes a day. And then also special thanks to the Elizabeth Dole Foundation, because at the Red Cross, we also have a caregiver resiliency workshop where we're helping caregivers online right now engage in self-care and wellness activities when they're just so important. There's no one size fits all for anyone when it comes to self-care, but I think reaching out and finding opportunities, finding peers, finding resources like the Hidden Heroes caregiver community can really help you get on track to finding support and meaningful self-care for yourself.
Thank you so much, Melissa. We're going to turn it over to Aubrey. We're going to take questions now. We're looking forward to getting to as many of you as we can.
Yes, we are. Thank you so much, Stephen. Thank you so much to all of our presenters today. We are so appreciative of all their time and the information. We are getting so many positive comments in both the chat and the Q&A box. Just as a reminder, if you do have a question, please make sure you type it in the question box. We will make sure to get to as many as possible. But before we get to that, we do have 3 Amazon gift card winners to extend some prizes to. So I want to just highlight our winners for today. We have Yvonne Gilbert, Richard Huffman, and Kirsten Verkamp. So congratulations to those 3 on the webinar today. I'll reach out to all 3 of you in the chat box just so I can get your information. We're going to send you a $25 Amazon gift card. So thanks so much for participating in today's webinar. So we have a couple of questions, and the first one I'm going to ask is for Dr. Lieberman. So I'm going to welcome him back to the conversation. When we first, the question for him is, when will we be able to pick up medical supplies? So things like masks and tubing from VA clinics again. Is there any word on that?
So thank you for that question. I would first encourage you to reach out, if you haven't done so already, and see if they can mail you whatever supplies you need. That's the preferable route at this time, since we are still just gradually reopening. But if there's something you really need, I would encourage you to reach out to your primary care team to see if they can determine how to help you with that. Hopefully, with time, with weeks, we will be open more and more, and you can go in for these things. But in the meantime, if it's something urgent, I would check with your provider and see if they can mail it to you or have you come in to receive it.
Wonderful. Thank you so much, Dr. Lieberman. I'm now going to ask this next question here for Dr. Kligler. So first of all, we are getting a ton of positive comments in the chat box, and there's a lot of folks that are really excited to see these tools that you demonstrated today, and definitely we'll be checking them out once we wrap up here. But Dr. Kligler, are there plans in place to add additional yoga and Tai Chi videos to the VA Whole Health page or Vantage Point blog? I believe right now there is currently just one of each, so they would love to see a little bit more of the breathing, relaxation, and visualization videos.
Great. Yeah, we're going to be continuing this process. So right now, it's 3 times a week that we're putting up a new post on the Vantage Point blog, and then that goes on, obviously, the Facebook page, etc. So if people are we're certainly open to hearing what people want more of. So definitely, if people are looking for more yoga and Tai Chi options on there, we can go there. I mean, we're anticipating hopefully continuing this through the epidemic, but even beyond, because we think it's just such a valuable way for people to move towards taking care of themselves. So I will pass the word to the staff that's curating those and say more yoga, more Tai Chi. Thank you.
Excellent, thank you. I'm now going to ask a question of Steve Schwab. This question is from someone who is a caregiver to her husband. Can you talk about support that is available for caregivers?
Absolutely. Thanks for that question. Whether or not you are a caregiver in the program for comprehensive assistance, there's lots of support out there. You just heard from Melissa. Melissa runs an organization, the Military Veteran Caregiver Network, out of the Red Cross. It's a fantastic network with myriad resources, peer connections. You can go on and on. We also have a network at the Elizabeth Dole Foundation at hiddenheroes.org, the Hidden Heroes Caregiver Community. We also have a series that is just for caregivers called C3. That series is in partnership with Wounded Warrior Project, and we do an episode sometimes twice a week, pretty much every week, where we're giving you practical information you can use every day. We did last week we did healthy cooking. This week we did, just yesterday, we did mental health tips and support. So come to hiddenheroes.org, go to MVCN, and check out Military Veteran Caregiver Network. Go to WWP. They've got a lot of caregiver tools and resources as well. But also va.gov/caregivers has a ton of information and support for caregivers at the VA, whether or not you're a part of the formal caregiver program.
Wonderful, thank you so much. I just want to actually launch a quick poll here. We want to get your ideas on what you found yourself doing during this COVID time, during this pandemic. So you'll see, for those of you that are logged in through a computer, that a poll just launched on your screen. For anyone that is connecting with us on our live stream on Facebook, feel free to type in those answers in the chat and the comment. But we have 2 questions here in this poll. The first one is, during COVID-19, I have found myself using self-care resources more often than usual, less than usual, or about the same. And the second question in this poll is, what forms of self-care have you tried? I know Dr. Kligler took us through all of these different kind of options, but we want to know what you've been doing. If you've been doing all of them, that's wonderful. We want to know what you've been doing and what you tend to gravitate towards during this pandemic and during this challenging time. So while that is up, I'm going to continue to ask a couple more questions. Dr. Kligler, I'm going to bring you back to the conversation. What advice can you give for caregivers trying to coach? It's their words, not mine. So tough old vets in trying to find some new age therapies. This person asking a question, their veteran is weary of anything that's called yoga. So how can they introduce people who are maybe a little bit hesitant on some of these things?
Yeah, I think the most important thing about that is meet your veteran where they are. And so if they don't want to call it yoga or think about themselves doing yoga, call it stretching, call it mobility exercises. You know, you can call it whatever you need to call it. And similarly, I don't think it's necessarily matters if you're talking about, for example, breathing exercises. It really doesn't have to be associated with any specific tradition. You don't have to call it meditation. I mean, that little exercise we did with the out breath, just plain and simple in and of itself. You don't have to call it anything other than a little breathing exercise. And I think just taking all the labels off it is what really helps some people, because the labels make them think of it in a particular way, and actually it's much simpler than that, and the labels sometimes just get in the way. So I'd encourage you to just call it whatever you think is going to work, but the most important thing is just get them to do it.
Excellent. Thank you so much. So while you were just answering that question, I did share the poll results with everybody that is looped in for today. So we found out that most of you, about 54% of you, are actually using self-care resources more often than usual during this time. So that's wonderful to see that you're using these resources, and the types of resources or self-care that they have tried. A lot of people trying mindful breathing. So over half of you have tried mindful breathing. Almost half of you have tried meditations. That's also wonderful to see. And then almost half of you have tried something else that's not listed. So different than yoga, meditation, acupressure, and mindful breathing. So would love to hear what some of you have tried if you'd like to share in the chat box. But right now we're going to get back to a couple more questions. We have just about 5 minutes here before we wrap up. So another question, I'm going to bring Nick from Philips into this conversation. So welcome back, Nick. You showed a slide of soldiers doing yoga. I remember when the Master Fitness Trainer program started, a lot of commanders shot down this approach. Is this your sense that commanders are buying into this now, or what are your thoughts on that?
I think unit commanders are becoming more progressive to ensure that their troops are healthy. You know, now that there is new data, that there is the science that we spoke of, and it's more easily available, I'm hoping that it continues to inflect. But I urge you to do a quick web search, and you just got to type in yoga for military, and you're going to find a number of well-sourced articles on yoga in the military. In fact, there was one great article that interviewed the Deputy Commander General for training for the Army, and he was praising the benefits of yoga and why it's being incorporated into the fitness program. So I do believe that this will help, especially with this level of leadership, in driving the culture.
Thank you so much for that, Nick. Dr. Kligler, I'm wondering if you can tell us to what extent is there collaboration between primary care, specialty care, and whole health programs across the VA?
I would say we are making great progress building those collaborations, and I would put mental health into the mix too. I think we're still relatively new. I mean, we've been around for a good number of years, but it's still a bit of a change in the way people think, and sometimes breaks people out of their regular patterns of thinking. So I think in some places, the primary care teams are fully on board and open and referring back and forth to whole health. Some places even have a whole health coach actually embedded in the primary care team. And in other places, they're still just dipping their toe in the water, really. And in those places, it's important that veterans and caregivers, that you all feel comfortable asking for it. Because if you ask for it, they may not be offering it just because it's still not so familiar to them. But if you ask for it, for the most part, people are going to be very open to including it. I think, some parts of specialty care are more, on board or involved than other parts. Sometimes the surgeons are always the toughest nuts. They just want to get in there and fix that hip and get out of there. But on the other hand, I just had a surgeon contact me about a research study. He wants to include music therapy pre-op and post-op just to see what it does for recovery. So, I think in every area, staff is looking for things that will be better for the veteran and will work better. And so I think that's ultimately what's gonna move us forward is people seeing the results and building those connections.
Excellent. Thank you so much. I'm going to try to squeeze in about 2 more questions here. So we want to get to as many questions as possible. Dr. Lieberman, this next question is for you. If someone has an existing VA appointment coming up, can they also get a COVID-19 test at that time? And what should they do to make sure that happens?
Thank you. You could definitely get the COVID appointment at the same day. I suggest, if you want to ensure it happen, that you call in prior to your appointment. Call in, no matter who your appointment's with, I would call into your primary care team and tell them you're interested in getting the test on that day, and can they help you to arrange for that to happen.
Excellent. Thank you so much. Last question here today is going to go back to Dr. Kligler. Are there other forms of mindful exercise that can give the same benefits of yoga? We've talked a lot about yoga in these Q&As. Maybe for people who have some joint issues or some joint replacements, anything that maybe could be a substitute of some sort that would also be impactful.
Sure, absolutely. I mean, I will say Tai Chi has been used a lot. Tai Chi, which is another kind of movement stretching mind-body discipline, has been used a lot in older people and in people with limited mobility. And, you know, when you see people doing the fancy Tai Chi, it may look like a lot, but a lot of the Tai Chi forms can be reduced to very simple but really effective way to move, way to access that kind of energy. And, you know, the fact is, you can be extremely limited in your mobility and still get a lot out of that kind of movement. You know, I would just throw out one more thing, and I know this sounds probably overly simplistic, but even what you might call mindful walking, just slow, easy walking, but paying attention to what you're doing and paying attention to how your body feels, even that is going to get you some really substantial benefit if you just spend a few minutes doing that every day. But there are lots of other options out there, and we'll work on continuing to push those some of those tools out there so you can see what they are.
Wonderful. Thank you so much. You'll notice that if you're still with us, we just launched our last poll of the day. We are looking to do the Spotlight series at least once a month. So we want to understand what kind of subjects you would be interested in hearing about. Rural health resources, family support, maybe something else. Maybe all of these would be of interest to you. So we want to hear from you. I will also mention that Dr. Kligler has so generously offered to do a second follow-up to answer all of your questions in another 1-hour session. So we'll be scheduling that very soon. Stay tuned for that. A webinar recording along with all of the resources from today will be sent to everyone who joined us. I want to thank all of our presenters and speakers today for their work and their efforts. I want to congratulate all of the Amazon gift card winners, Yvonne, Richard, and Kirsten. I'll be following up with you very soon after this. Thank you all so much. Stay safe and have a wonderful Memorial Day weekend. Thank you. Bye.